everybody. Back to this is Texas Senator Bob Hall, Senate District 2. And for those of you who've been following us, you know we've been working with doctors throughout Texas and actually throughout the United States for over a year now in this issue of the COVID. And there's been of course, you know, an uptick there recently in the infections of the so-called Delta virus and whatever else it might be. And I'm getting an awful lot of calls about what can we do? Is there an alternative to the vaccine? Now, first of all, I want to tell you that I'm an engineer. I'm a businessman. I am not a doctor. I am not giving medical advice. I am just a facilitator that working with doctors, frontline doctors who are actually hands-on in clinics working with patients. And I'm just facilitating getting them where they can communicate and make their information available to folks so they can make their own decisions about what to do. And those of you who've watched the previous videos, you've seen lots of doctors from all over the country talk about fairly common approaches with therapeutics that are out there to treat the symptoms. And one of the things that's been amazing to me and to others is that this has been a disease that for somehow the mainstream medical community has bypassed the step of prevention. And that has always been the preferable way to treat an illness, a disease, is just to prevent it from ever happening. And then the second step is, if it does happen, is early intervention, quickly getting with the patient and start treatment before it gets too seriously along. And we seem to bypass this with the COVID. And now it seems that the push is for vaccine is the only solution. And these doctors that have been working with said there are other ways to do it. And one of them that I have with me today is Dr. Amy Offit. She's a medical director and co-owner of Heart and Soul Integrative Health located in Marble Falls, Texas. She's been working with us well over a year now, one of the very first doctors on our very first video conference that we had. She completed her undergraduate studies at Abilene Christian University Medical School at the University of Texas Health Sciences Center in San Antonio, was a resident in family medicine at Christus Health. And she also has a master's degree in integrative medicine from George Washington University and has completed a fellowship on integrative medicine. Dr. Offit has treated almost 1,000 patients over this past year. 600 of those have been on preventative treatments. Only 24 have gone to the hospital, but none have died. And so Amy is well qualified to explain to you what she has done and how she handles patients who are people who are concerned about either getting the COVID or are in the early stages of it. And so I'd like to welcome Dr. Amy Offit to talk to us about her protocols and what she does.
Thank you, Senator Hall. It's really a privilege that you asked me to come today. I have been praying a lot this last year for just strategies to help sick patients, and things have come together pretty nicely. And it's wonderful to get to share some of that information. I think education is power. So if our Texas community and other communities know more, they can handle the situation better. So if it's okay with you, I have made a few slides that I'd like to show and just kind of walk through some information that I think might be helpful to anybody that's watching.
Oh, that'd be great.
So this first slide actually was from one of Dr. McCullough's printouts, but I think I've used it quite a bit to show people a little visual demonstration of what is happening on a timeline with patients when they get sick with COVID. This is someone who's not treated. So as you can see, the first week or so is when the virus typically replicates. Somewhere along the line, the cytokine storm process starts, the symptoms start to escalate, and then the red and worst phase is when microthrombosis sets in. And our goal in treating patients is to catch them during the first phase when the viral replication is happening. And patients do have symptoms during that time. Unfortunately, some of them think it's just a little allergies or, I've heard people this week say that they inhaled dust or things like that. So they're waiting. But honestly, if we were able to treat them within the first few days, our experience has been that we could stave off progressing to the second and third phases, which are the more serious phases of this disease, and try to keep people out of the hospital to begin with. And so that's the goal. So there's a reference at the bottom of most of these slides too. And if anybody has questions, I think I've given Senator Hall and his staff permission to share these slides afterward. Our office stats, we've currently, as of yesterday, treated 941 patients. 24 of them have gone to the hospital. A lot of the hospitalized ones were late treated or very high risk. We've had 0 deaths with early treatment. We did have 1 death, but the patient had had a transplant. He actually went to the ER multiple times, and he wasn't sick enough to stay in the hospital. And on the 12th day, we saw him and he was already very, very ill, and he did not make it. So we triaged him back to the hospital, but he didn't survive, which was very sad, but it's telling. He had progressed all the way into that later stage that I was showing earlier. We've treated kids as young as 4 and adults as old as 98. And we individualize the care. So we're not treating everyone with exactly the same regimen. We're using strategies that help make sure we're covering all the bases that make sense regarding each patient's risk, benefit, baseline health, maybe how long they've been sick and so forth. Wanted to show a couple slides about early treatment. A lot of people say it's not proven or it's not tested, but really it's unfortunate that a lot of people just haven't looked. This is a summary slide that you can see the reference for at the bottom. That's actually including several studies for early treatment of COVID illness with ivermectin. The green studies all have favorable outcomes and the reds don't have favorable outcomes, but you can see if you actually go to this source, you can see the meta-analysis weighs highly in favor of early treatment and prevention. This is also from the same source. This is published online. You can pull it for yourself. I would encourage you, if you have a doctor that you've known and had a good relationship for a long time, to share it with your doctor. This is similar to what we're using for our prevention. I'm going to show our actual protocol in a minute, but it is available to you. This actually was, I want you to focus on this one on the prophylaxis column here. The percentages of improvement with ivermectin are substantial. So if anyone says it doesn't work or it's not proven or it's not tested, this should hopefully give you some resources to show them that maybe could convince them that that's not true. This is our actual office protocol. I'm going to give you a few caveats because we do give caveats with our patients. We don't give vitamin D in this high of a dose. If someone's already taking regular vitamin D, we might modify it. Again, we individualize the therapy, but most people who get really sick are not on any. So we'll do a 3-day loading dose, which I've done for many years for people with low vitamin D with no problems. We like them to take it with food. We add vitamin C, we add zinc, NAC if patients can get it, quercetin, melatonin. We sometimes use some antiviral herbals. We've had some good luck with those as well. And then we sometimes also will use a nebulizer protocol. And I think I previously shared that. I'm happy to share that again. If someone is higher risk and wants prevention, and that could mean they just have a lot of exposure, but anyone who's over 50, overweight, has hypertension, heart disease, diabetes, cancer, lung disease, those patients really do warrant a higher level of preventative care. We'll use hydroxychloroquine sometimes with zinc. We'll use ivermectin sometimes. That's a weight-based dose. And then we'll have people, I actually have people use a nebulizer after they've been out in public to try to cut down on any viral exposure. And if you look even at the source I shared earlier, there's some data to show that even using a mouthwash after being out in public can be helpful. So those are little hygiene measures that can be helpful. At the bottom here, we also sometimes do give IVs. That's usually honestly reserved more for the sicker patients that we're trying to keep out of the hospital. Just wanted to show you that around the world, some other countries have adopted ivermectin, and they have, if you want to look, there's a huge amount of data at this website. And if you want to look for yourself, it does make a difference. So I would love to be able to treat more patients myself, but I'm hoping that by sharing this information, a few more doctors out there who aren't sure what to do to help their patients will actually consider looking at the real science. I think we hear on social media and the news that we're supposed to follow the science. So I actually did put the definition of science here because it's lost its original definition. It's become used as a word that is honestly not following its original meaning. If we really used the science, we would use the data that we have to use everything we have in our toolbox to help every patient that we see. And lastly, I wanted to share with you, Senator Hall, something about the Hippocratic Oath. I've heard that thrown around a lot this last year. And actually, the Hippocratic Oath, the original one, is somewhat antiquated because it talks about Greek gods and things like that back in the days of Hippocrates. But the 1964 version has many assignments in there for those of us taking care of patients, one of which is preventing disease whenever we can, for prevention is preferable to cure. And I think even right now that vaccinated people are getting sick. And so I've been giving even vaccinated people preventative regimens, especially if they're high risk, to try to alleviate the degree and the progression of their sickness. And for people for whom the vaccine hasn't had enough safety data to encourage them to get it, I think this option of prevention would be a good interim measure. And I really don't see any downsides other than that it can be somewhat challenging to find a doctor to prescribe these things. We're doing the best we can with everyone that calls us. And I know other doctors out there are doing the same. There are a lot of other doctors out there in bigger cities who've treated a lot more patients than I have, who have had similar numbers to mine as far as noticing a huge improvement in patients if we can catch them early. It doesn't make everyone prevent the disease, but neither does any other strategy out there. So I think the other nice thing is if you are on a preventative oral prescription regimen, it is something that maybe hopefully whenever this fades, we can stop it and it won't be an unpredictable safety issue for patients in the future. So I really appreciate you for letting me share these things. I'm going to stop sharing my screen and see if you have any questions for me.
Okay. Well, thank you, Amy. That covered it very well, and the emphasis there is certainly on preventing it. That we certainly have demonstrated that over the last more than a year now, but with you and multiple doctors who recognize that we don't necessarily have to follow what the CDC and the FDA has to say, which seems to be operating with a strong political agenda that is certainly not in the best interest of the people of Texas. And that was real clear to me early on when there was such an outcry coming out of Washington to bypass the prevention and early treatment, which was just so out of line with what all of you were saying. Is saying, wait a minute, don't wait till, and I happened to see it firsthand. I had friends of mine that actually went to the hospital and they would be sent back home because their pulse ox was not low enough, and they were sent back home and told come back in when they were sicker. And when they did, there was really no treatment for them. They were put on a ventilator, on a respirator, and then moved to a ventilator. And the fortunate ones did walk out of the hospital eventually, but it was really basically their immune system that finally kicked in, which is, as we know, was God's treatment uh, protocol. He gave us an immune system, and unfortunately, a lot of people have not recognized the importance of their immune system and have not kept it up the way it should. And I think from what you've said before, you found that those people that have a good immune system are far less likely to succumb to the COVID. Is that not correct?
I don't know if you noticed on our treatment sheet, but we do emphasize healthy lifestyle, eat clean, get enough sleep, move around, take good care of yourself. And if any of the messaging was missing from the masses this year, that was it. Like if this year when people had downtime and home time would have been a great time to focus on looking at their own health and working on it, because the healthier that someone is, the better that they do with this illness. And honestly, we've known that forever. That's the truth for every illness, and most illnesses are lifestyle induced anyway. So, you know, in integrative medicine, we try to help people as much as they can unwind some things that happen to them, especially that are lifestyle based, like diabetes and hypertension. And sometimes we're successful and sometimes we're not, but it's worth partnering with them to help them get there. I've noticed, I was going to say one more thing, Bob, that I've noticed this year that that something's kind of come true. A doctor friend of mine last year told me to read a book called The War for Kindness. That's a book about just how kindness is less and less present. And his, I might be over paraphrasing, but the author said that empathy fades when people feel overwhelmed. And this year, people have felt overwhelmed. Some people are overwhelmed by the fear of getting sick. Some people are overwhelmed by the fear of losing their freedoms. So all of us, if we come together and we feel overwhelmed, we lose our empathy for each other. And so I'm not treating people based on anything except their medical condition and their health. And I feel that as long as I'm focusing on each patient and what I can do to help them get healthier, stronger, and get through this, I feel like if we could all just get through it ourselves, we would be healthier than trying to shortcut it or do these other experiments on people. Because most people who've recovered do have good immunity, as you mentioned. And I mean, that's the case for me. I had antibodies that I noticed last year in April. I tested myself because I'd been sick in January, but I didn't know what I had. Well, I had antibodies in April that have lasted all the way until the last time I checked, which was just a few months ago. And I've been around a lot of sick people. I haven't gotten sick. I'm 51 years old. I do work a lot, but I'm pretty healthy. And I think that other people who've been through it have similar antibody levels, hopefully, or T-cell immunity, and can also feel fairly strong. It doesn't mean that with the rapid spread of what's happening right now that we shouldn't take extra measures of precaution. I mean, don't get sick if you don't have to get sick. But I think stratifying people into groups and then deciding what to do would be the right thing for doctors who may be watching this. If you haven't been treating and you're a doctor and you want some advice, some charts, some graphs or algorithms, I'm happy to share those with any doctor that wants them.
Wow. Thank you. Thank you so very much. And, you know, you talk about the immune system there. I recall early on, we had one of the Zoom meetings, and that was the kind of the center of the conversation was the low immune system were the people that were getting sick real quick and getting in the hospital and dying, and talking about building up your immune system. And so in the following week, on our weekly call with Health and Human Services, I asked that question. That was back when they would talk to us legislators. I asked the question, why aren't we informing people about what they should be doing to improve their immune system and be less likely to contract this an infection from the virus? And the folks from Health and Human Service on the line actually laughed at me, saying, and their response was, "Well, we just don't do that kind of thing." And I thought, wow, what a arrogant, uh, thoughtless response that was, because I said it cost us nothing, and it's something that would be very helpful to the people and was accurate in information. But they said we don't do that kind of thing, and so that was very, very disappointing. And so that's one of the reasons I pursued this, trying to get the truth out, working with you and the other doctors. Really appreciate you taking the time to put this up. And I'm going to see if we can't put a couple of charts up at the end of this, where we show people how they can contact you, uh, uh, and once they've heard this, and the links to the other sites that are out there that have doctors that are joining it, that really can handle across the country, so that folks that want to find that their doctor is refusing to treat them. And I'm still finding people coming calling me and saying, I went to my doctor and they refused to treat with ivermectin or hydroxychloroquine. And I would tell them, time you find another doctor, because you need one that will actually treat you. So we can hopefully put that information up. We'll also have it on our website.
Great. I think, Bob, if we could all get our egos out of the way and actually, if I was a doctor and I worked for a large corporate medical practice and I was told that I could not do these things, I would be very challenged, especially with so much data to look at, to follow that. And I know a lot of doctors these days don't work for themselves. I work for myself, thankfully. But I would encourage them to still read the data, to still go back to those basic tenets of being a physician and a healer and taking care of the patients in front of us, because we could make a huge difference if more of us would just start with these basic tools. It doesn't have to interfere with any other choices people make. It would just be for the patients that need it. And doctors know who that is. They just are, for whatever reason, sort of looking the other way during this crazy, chaotic time in our history. So every day, that's part of my prayers too, is that more doctors will get back to what they chose to go into medicine for, which is to help people, and start helping more and refusing and resisting less. So, for what it's worth.
Okay. Well, thank you very much. Folks, now here is a chart that will connect you with informed professionals. This is a list of websites that have doctors who are actually treating patients, both preventative and early treatment outside the hospitals. They have been very successful. These links will take you directly to doctors or to a list of doctors, depending on what area you're in. Many of them are actually treating telemedicine. So make a screenshot or copy it down, and hopefully you never have to use this for treatment. But if you want to get on a preventative regimen, you can go to one of these links and it will help you out. Well, folks, there you have it, right from a real frontline current operating clinical doctor in Marble Falls, Dr. Amy Offit, telling you about nearly 1,000 patients that she has seen and treated preventatively and the success that she has had with it. So there is hope for you. There is alternatives to the jab out there. You just need to get with the right doctor to do it. In the meantime, God bless you and God bless Texas.